The following events were recorded as they happened at the Hospital for Sick Children in Toronto. In this episode of Life's Little Miracles, Samuel's kidney transplant and Stephanie's knee surgery. Three-year-old Samuel Mazza and his parents have traveled to Toronto from their home in Saskatoon. Samuel has chronic kidney failure and needs a transplant to survive. His father, Francis, will undergo surgery to donate a kidney to his son.
Just kind of nervous of that look of yours.
You okay?
Your daddy's giving you a very special present. You're gonna get your daddy's kidney.
Now the transplant is in jeopardy. After removing Francis' kidney, doctors have difficulty flushing the arteries of blood.
Vasopressors. I need his pressure up. His kidney feels too soft. When we take the kidney out, we have to clear all the blood completely. Otherwise, the blood forms little clots inside the kidney.
How's that now? How's the flow now?
None.
Okay, have I got any flow now?
No. Hang on.
There you go.
Now you've got it.
Okay, because that's going right in the artery now.
Good.
It is getting clear. It has now cleared that upper pole.
Coming through. 1, 2, 5 goes 1, 2.
All done. What Dad is just waking up now. I had to make his incision a little bit longer than I normally do just because he's a big guy. It was very hard.
It was. So is he going to be, I mean, he'll still be same amount of pain or whatever, like it's not going to affect that.
Maybe a bit more sore than our normal guys. And Dr. McClory is now just beginning to sew it in, Samuel, and opened up the vessels that he's going to be suturing to.
Yeah.
And he's starting to do the sewing as we speak now.
Last year, 8-year-old Stephanie Onandraj had surgery to repair a malformation in the cartilage of her left knee joint. Now, her right knee has developed so much pain that sometimes she's unable to be active. Today, Stephanie will have a second surgery.
So tell me about these knees of yours. When did they start to hurt?
When I went last year in winter.
So you used to have sore both knees, and then we fixed one, and now the other one's acting up. Oh, okay. And what makes it worse?
Skipping and rollerblading.
So it's slowing down your fun, is it?
Yeah.
Okay. We'll start with simple stuff. This goes around your arm and feels your big muscles. Do you have big muscles?
No, Daddy has big muscles.
Oh, Daddy has big muscles.
But I can beat Daddy.
Oh, yeah? What do you beat Daddy at?
Wrestling.
No way. Great.
She's become a veteran.
I want to be a professional doctor.
A professional doctor, not just a recreational one. That's good. Good for you, kiddo. Go for it.
Thank you.
Bye-bye.
Bye-bye.
Bothering you?
Come on, over here, it's gonna be okay. Is your knee still bothering you? Yes. In some people, when you move your knee back and forth, it will catch the meniscus inside between the two bones and pinch it. And so that pinching hurts. And some people get symptoms from it. We can take the middle part of the meniscus, which is a torn part, and we remove it and just leave a normal rim around the outside.
She cannot do strenuous thing like tap dancing or,
Yeah.
you know?
She should be able to, once it's all healed, she can do whatever she wants.
Yeah?
Yeah, as long as it's legal. And and Mom and Dad say it's okay, you can do whatever you want to. There's no operations that are completely without potential risks and complications, but it's possible we might need to make a bigger incision to take the little piece of cartilage out. Okay.
In big kidneys in little children, I find what influences me most is just the lack of space. Okay, ease the kidney down. Slow down a bit. Take up the slack on the other strings, please, Jyoti. As I'm going down. Ease it down. It's stuck. Use an instrument if you could, Alan, just I can't see. There's the kidney pinking up. So we're not making a lot of urine. That I think we can tell.
It may have a bit of ATN, and hopefully that will resolve on its own. We'll see what the ultrasound shows.
Well, I'll go and have a chat with the mother.
He's shivering from the anesthetic, and we're trying to get him warmed up. You're sore? Are you sore, Nick? You're still cold. Okay.
Hi there. How are you? Dr. McClary. We're all finished with a little boy.
Okay.
And everything has gone as well as we could want. With respect to the kidney, he's not putting in a lot of urine right now. He did originally.
Yeah. So why wouldn't his kidney be producing lots of urine?
It just takes time sometimes to adapt to the one change to the other. Okay?
Thank you.
So you've got two loved ones here.
Yes.
And they're both doing as well as we thought.
Great.
Okay?
Yes. Thank you.
I'll talk to you later.
For kids, it's quite scary, you know. Even for adults, it's quite scary.
We're ready to go in. So, do you want to walk with me to the door? Okay. So, we're going to say goodbye here. So, if you want to give Stephanie a big hug. Go goodbye.
It's strong good, right?
Hey, Stephanie, I just have a little clip that goes in your finger.
Yeah, I'm just going to start giving you some medication, okay?
Just take some nice deep breaths for us.
Do you want to hold the mask?
It's actually up to the ICU. He's on some morphine right now, so when he wakes up, he should be in.
Mommy's here, Samuel. It's okay. Mommy's here. Mommy's here.
They'll be checking his urine. Like tonight, they're probably going to be checking it every 15 minutes to half an hour.
Or you just bring out some, yeah, actually, yeah.
Let me just take these off. Why? You don't need them now. Where's the other one? Where's you got one more down there? Yeah. Let me get up. All right, let me get up now.
Mommy.
Okay, it's okay. Just to the new bed.
Just to the new bed.
Okay?
Mommy, can we?
One. Yeah, I'm coming. Okay.
Mommy,
One,
can we?
2, 3.
There.
Hey, there.
So we're putting all this fluid inside the knee joint itself. So I'll put it inside and we can see what we can see. Okay, so now you can let the fluid in. Okay, now, there's our meniscus. See the stuff over there? The tip of that probe is pointing at the femur. The bottom part of the probe is pointing at the tibia. So we're going to need to remove some of the inflammatory tissues around the outside of it And then we're going to take out the middle part of that meniscus and shape it down to make it look like a normal meniscus, like the one on the other side.
No, at least for the rest of her life, she doesn't have to go through that pain again. At least she can live a normal life, not worried about pain or anything like that.
Nice to see you. Daddy.
Sonia,
Dad.
how are you, buddy?
On my tummy. Yeah.
Did they clean you up? Huh? Did they wash you?
Well, he's just sweating. He's not feeling good, hey? You don't feel good either? No. You can show Daddy how you can blow bubbles.
You can blow bubbles now.
That lady brought you some
Let
bubbles.
me see how you do it.
You miss Daddy?
I miss Samuel too. Miss you, Samuel. Maybe later.
You can hold his hand.
Maybe later, come back.
Why don't you hold his hand? There, you can hold hands. There.
Daddy.
You see like the little piece flapping right in the middle? It's like having a tire with a little flap on the end of it on your bicycle or your car, and every time it flops around, it bangs and makes noise. Or there you go. Okay. See, perfect. And there it is. It's nice, like a normal-looking meniscus, well attached.
Hi. You did great. Very great.
Everything went absolutely perfect, just like on the other side. The loose piece was moving back and forth in the knee. We took out the area where the tear is and shaved it back down to make a normal rim around the outside, just like we did on the other knee. And she should do very well. Okay.
Thank you.
Okay.
Thank you
Do you have
very
any other
much,
questions?
No, that's
okay.
it.
Thank you very much, Doctor.
Okay, so they're going to take her to the recovery area, and then once she's feeling comfortable, she'll be able to go home today. Okay.
He's complaining about some pain in the tummy, right? Is there any fever or anything else going on today? Okay. No fever, right? Let's do the test.
That's Daddy's kidney.
Samuel's kidney now.
It's yours now.
Yeah, it's yours now. I think you get to keep it.
You're not afraid anymore.
Okay, I'm all done.
This is Samuel Mazda's belly, and there's a sliver of air up here. If that persists and stays there, then that could be more worrisome that something is going on in his bowel.
Right away.
Sure, it's
easier.
Feeling tired? Sleepy?
No pain?
No.
Started. She's fine now.
Karate. Hey, don't shake too much.
Relax.
At home, okay? Karate. Right.
Hi guys. So, but he does have this abdominal pain. He's growing this bug, you know?
So you think that's what's causing his
I do.
abdominal pain, okay?
You know?
Okay.
See you, Sam. You got an eyeball. Oh, there you go. Look, Samuel, look. I can see you with my scary eye.
Come on. Yeah.
Yeah, I just want to see if these are tall enough for you. Since you grew, eh? They might be too tall. Is that too tall?
Yeah.
Yeah.
Let me.
Where were they before down here?
Now we'll have to do trial and error.
Yeah, to see how tall she is.
Yeah, this is better.
That's a good height?
Perfect?
Yeah.
No, just till here and come back. Just in that diamond over here and come back.
3 hours after her surgery, she's trying to walk. It's not bad. Good girl. Good girl. So you cannot be going out and playing and all, right? Once it heals, then you can play, okay?
Hey, Samuel. This is the first time I've seen you since you donated the kidney, and you look very good.
I'm doing okay.
It's a big operation, as you've found out, and it's painful.
Yes.
But you look like you did before. I think you've lost a little bit of weight. Do you think he's lost some weight?
I think so.
Okay.
Thanks.
Well, there have to be some benefits for this. And the biggest benefit, you look at your son, and he looks great.
Yeah, he's doing very well.
Yeah. This is his 8th day, and as far as we're concerned, he's done very nicely in his response to his immunosuppression drugs. So he's got the kidney functions very well. All in all, I think he's marching through all this very well.
There you go.
There you go.
Look at you. Pretty soon you'll be eating sandwiches. Oh my goodness.
Slow down.
How are you doing?
Fine.
Fine. How's your knee doing?
Okay.
Okay, can I take a look at it?
Sometimes she cracks her knee and is howling in pain.
Really? How do you crack your knee?
I just stretch it, and then when I just bend it, sometimes it just comes.
Okay, maybe what she does is she can make her kneecap come in and out of joint a little bit, which may make her uncomfortable. It's possible. That's what's doing it. And, I'll write your prescription for a physiotherapist. Okay? That sound okay to you?
Yep.
Okay.
And now she can almost do anything and everything she wants,
Yeah,
right?
she can do whatever she wants to.
I can even rollerblade.
I make sure she's padded well. Elbow pads, a wrist pad, a
helmet.
knee pad, helmet.
Yeah, don't forget all that stuff.
Everything has to be there.
Okay.
If I catch her without any one of them, she's grounded.
Okay, it could be doctor's rules too.
You want to be free, isn't it?
Yeah.
9 weeks after surgery, Stephanie's knee has fully healed. By having the cartilage in her knee repaired, she is no longer experiencing pain and is able to resume her active life.
She wants to try everything. I wish I could try the whole world. Daddy! Daddy! Go away!
Boys, look it. You got a present.
I got Annie.
We got Annie.
Oh.
Look at this.
Oh, here we go. Hello, is that your mommy? Is that your brother? It sounds like he had a really nice weekend. From what I hear, no more pain. So we're happy with his tummy. I mean, his tummy's nice and soft, he's eating, he's not vomiting, no more diarrhea, so I think things are looking really good. Okay. Yeah, we'll see you daily for blood work. And I mean, fantastic, right? Will you say goodbye to me? Goodbye. Okay. Good luck.
Are you ready now?
Yeah, ready.
Okay, let's do it.
2 weeks after his kidney transplant, Samuel can be discharged.
Going home finally.
His family will live in an apartment in Toronto for 2 more months to be close to the hospital's transplant unit. Samuel will be monitored throughout his lifetime, but doctors are confident that his transplant has been a success and that Samuel will continue to thrive. In the next episode of Life's Little Miracles, Kala's struggle with cancer and Kieran's shunt surgery.